Thank you so much. And I really greet all the guest speakers of this session. Thank you. Over to Pawan Sharma.
Thank you. Thank you very much, sir. Now, I would like to welcome in our scientific session 3, webinar number 1074 to celebrate Ayurveda Day 2023. And the topic is unique Ayurveda for One Health. That means our Ayurveda, the life science, the traditional health heritage, is capable and sufficient to support the health system for human being to microorganisms. Really a great concept. I am grateful to Embassy of India, Dr. Sri Tanmay Lalji, His Excellency Tanmay Lalji, and his team to support us, and University of Latvia under guidance of Dr. Shantala Priyadarsani ji and Valdis Parag ji. Welcome. We would like to welcome you all in this session, though we are late from our scheduled time. But I hope now we will conduct continuously in fast manner. Only 2 sessions are left. In this session, Dr. Ramita Stina, Dr. Hema Malini, Dr. Venkatesh Gaonkar, Dr. Pooja S. So, we would like to welcome all the speakers for this webinar. Thank you very much. Thank you for joining. And thank you, Dr. Shantala Priyadarsani ji, for your kind coordination and support. You are in the leading move today. Thank you. Thank you very much. I would like to request Professor V.K. Agnihotri sir for brief preamble.
Thank you, Professor Pawan Sharma. Really, as you told that we are getting late, but what I am saying that all the new guest speakers are there as fresh as anybody, though we are sitting for last 4 hours or plus. So this is a pleasure that they are prepared very well, and they are going to enhance our knowledge with their presentation. So I welcome all the guest speakers of this third scientific session of our this international webinar, and as you welcome them. So this is the webinar session based upon the unique Ayurvedic concept for One Health. Of course, we are Vasudha Kutumbakam concept followers, and we do hope that they are going to enhance our knowledge with their presentation, with the help of the knowledge sharing in a form of the One Health could be possible with the rules and regulations, with the instructions of our Ayurvedic system of medicine for healthy life and also for the diseased persons. So thank you so much, and I welcome again and over to Professor Pawan Sharma ji for further conduction.
Thank you. Thank you very much, sir. Now I would like to request Dr. Shantala Priyadarsani ji for her brief preamble.
We are going to have 5 speakers now. So Dr. Ramita.
Yes, 5 speakers. Dr.
Sir,
Ramita,
are you able to?
Christina,
Sir,
Emma.
are you able to hear now?
Yes.
No. We are listening you.
No, you're not able to see the speaker.
No.
Now?
No, madam.
Now, sir?
No.
Now also you're not able to see?
Agnihotri.
No, ma'am, still not.
Sir, you have stopped sharing your screen? Has sir stopped sharing his screen?
Professor Sharma ji, आप स्क्रीन शेयरिंग
हाँ, मेरी तो बंद ही है.
अच्छा जी, मैम आपको ही करना है.
हाँ, अभी चालू हुआ.
Seeking the blessings of Lord and
Yes, great.
आगे.
Dr.
ऊपर से कर्सर हटा लीजिए, ब्लैक स्टेप बढ़ा दीजिए.
Professor and Head of Department of Rachana Sharira at Sushruta Ayurvedic Medical College and Hospital, S. Vyasa, Bengaluru. I'm also the associate editor of RGHS Journal of Ayurveda Sciences, or REGIS. Today I'll be speaking on utility of Ayurveda in long COVID. I have been associated with S. Vyasa Yoga University for the past 11 years. And this university offers graduate, postgraduate, as well as doctoral programs in Ayurveda, Yoga, and Naturopathy. The positive part of this university is that we have a holistic approach to all the patients that seek treatment from us. And from the academic point of view, we have a world-renowned lab equipped with top-notch instruments, uh, which we call, Anveshna Research Laboratory, which helps us to follow the traditional Gurukula methods with a modern scientific approach in teaching. Also, we have been part of development of various health protocols, that is yoga, including yoga and Ayurveda, for numerous national level health programs, especially the non-communicable diseases like diabetes and hypertension, which have proven to be very useful in managing the conditions, even in rural India. So, with that experience going forward, long COVID 19 is actually a term given to the lingering and protracted illness that the patients of COVID 19 continue to experience even in their post recovery phase. And it's not a single disease or a syndrome, but a set of symptoms persisting or developing after initial COVID infection. So these set of symptoms, they persist, after you have passed over the acute phase of the infection or active phase of the infection. So these symptoms can last for weeks or even months or years. So, why is this a cause of worry now? It's, especially because of the risk factors that are associated with it. Namely, people who are above the age of 50 years are more susceptible to these risk factors, and those who had been critically ill or have been on higher dose of antivirals or antibiotics, and during their active phase they had to stay for a longer period in the ICUs, or those people who are associated with comorbidities. So these set of risk factors have caused a panic button in the present healthcare. So even recently, U.S. Department of Veteran Affairs, they had published a study in Nature stating that the risk of stroke and heart failure has increased respectively by 52 and 72% post COVID, and approximately 65% of people who participated in a study knew at least one person who have experienced the symptoms of long COVID. So, long COVID has been recognized as a major cause of worry since 2020, and it presents with a wide set of symptoms affecting different organ systems of the body. So, it may be a set of symptoms affecting the cardiovascular, or it could be a set of symptoms affecting the nervous system or the respiratory system. So, like that, it presents with a wide set of symptoms, and it ranges from a simple cough, dry cough, or productive cough, fatigue, to more severe cases of brain fog or forgetfulness, anxiety, or sleep disorders. But during that phase, due to lack of systematic reporting of the long-term consequences of COVID, the data is still emerging. So this is where Ayurveda comes into picture, and this is where why we need to adopt and understand Ayurveda. Because if we study the symptoms of long COVID, every individual expects it in a different form. So we have to understand why that happens. Why not the same symptoms in everyone, or the same range, or the same severity of the symptoms in everyone. So this again, highlights the need to understand that every person is different, or the constitution or the prakriti of an individual is different from each other. So this will provide us an insight on how to bring back the homeostasis or the equilibrium in the body from a individualized medicine point of view. So for this Ayurveda, since time memorial, this has been the foothold of Ayurveda, wherein it prescribes dinacharya, that is a daily routine that a person has to follow, starting from the time to wake up till the time you go to bed. What are the rules or set of rules that you have to follow? What are the measures that you have to take while having food, so that it is properly absorbed and digested in the body? And what are the set of rules that you have to follow when you are in a society, so that it doesn't bring you mental agony? And there are set of 5 purificatory therapies which helps in warding off, or which helps in removing the aggravated doshas, that is vata, pitta and kapha, from the body. And all these these 3 set of measures together helps in maintaining the equilibrium of an individual from a individualized or a personalized medicine point of view. A few Ayurvedic formulations and that can come in handy in cases of long COVID symptoms are, basically we have to keep in mind the immune boosting mechanism. And since there has been a tissue damage, we have to think about medicines that can recover or that can bring that damaged tissues back. So, from Ayurvedic point of view, we have a set of medicines called as rasayana, which has to be prescribed depending on your condition or the systemic involvement or the and the prakriti of your body. So, few which can be listed out here are Chavanaprash, which is very widely available. Then we have Kushmanda Rasayana, Punarnava Mandaura, Ashwagandha Rasayana, and Pippali Rasayana. So all these medicines have been proven to be effective in managing these conditions, and also proven their effect in immune boosting mechanisms. Then apart from that, we have single drugs which can be utilized. These drugs are commonly available in our kitchen, like ginger, turmeric, or the Indian gooseberry. Then we have ashwagandha, which is gaining importance due to its effect on the nervous system. Then we have yashtimadu or licorice root. Then Tinospora cardifolia. So this rasayana and this individual drug usage alone cannot help us tackle the issues. We need to incorporate the yoga and pranayama as well in order to bring back the vitality as well as balance the internal environment. So all this said, India has already been facing alarming rise in the NCDs like hypertension, diabetes, and cardiovascular disease, as well as cancer, affecting almost 116 out of 1,000 people. So post COVID, there has been a significant rise in these also. Especially the age group that are affected here is between 26 to 59, which are the most productive group or so called. So this has brought about a higher burden on the public healthcare. So during the COVID period or the pandemic time, what the Ministry of Ayush they did, they adopted programs in India to create awareness among the public about the usage of evidence-based Ayush herbs. So the benefit of this was that since most of these herbs were easily available, in the Indian household, it became much easier to reach out to the people. And because of this, Ayurveda is, even though it has been already a mainstream healthcare provider in India, it is gradually gaining more popularity globally for its preventive and immune boosting properties. So, as we go to the allopathic medicine for, the emergencies, if we can adopt an integrative method, that is Ayurveda as well as allopathy together, that is, if we go hand in hand, that is definitely the way forward for a better healthcare globally. With this, I thank you and I wish you all a very healthy and blessed Ayurveda day. Namaste.
Thank you. Thank you, Doctor. Thank you very much, Ramita ji. Dr. Ramita is present with us. So with the kind permission of Dr. Shantala Priyadarshini ji, I would like to invite Dr. Ramita for 1 minute comment. Welcome, Dr. Ramita.
Most beautiful presentation, Dr. Remita. We would like you to answer something that Sharma ji will ask. You wanted to speak something, no, sir?
Just best wishes from Ramita.
Yes.
Your voice is not coming, Doctor.
Dr. Remita, you are muted. You're okay. Now you can speak. No, not able to hear you.
Now, Ramita, you can unmute.
Yes, you can speak now. Remita?
No problem. We will have her comments later on. But start your voice. No, not your voice is not coming.
She has taken up the best topic because in Europe, long COVID has become a very big problem, huge problem. So the inputs that she has given is very good. It could be of benefit to a lot of people. We will go to the next speaker, sir.
Yes, madam. Our next speaker, Stina, is also with us.
Are you able to hear, sir?
No. Neither here nor.
Okay. Now you should be able to hear.
Yes. But not here visible. Oh, please play. Play the video. Downwards. Yes.
Thank you all of my teachers for Ayurveda from both Sweden as well as India. And thank you, India, for providing this knowledge to the whole planet. We do for sure need it now more than ever. My name is Stina Andersson. I'm by education an engineer in land management and land surveying, and I started to study Ayurveda 2019. I work today as an Ayurvedic lifestyle consultant at Veda Management, and I'm the head of Ayurveda Association Sweden and the General Secretary of European Ayurveda Association. I come from the land of the Vikings, from the land of the Nobel Prize, and from the land of Carl von Linnaeus, a country where we adore nature. I come from the land of technocrats, where science has been the paradigm the last 300 years, and a land that believes that the body, mind, and soul are separated, where traditional medicine once was banned, witches were burnt, and until 1779 the use of magic spells was penalty by death. With a population of 10 million and relatively low population density, and despite high economic standards and access to wealth, Sweden grapples with issues such as anxiety, depression, stress, and various lifestyle-related diseases. These challenges stem from a modern, unhealthy lifestyle. One may wonder if it's possible to introduce and establish in Ayurveda in a country like this. I believe it is. Sweden's healthcare system is funded by taxes, accounting for approximately 1/3 of all taxes in the country. The Ministry of Health and Social Affairs dictates health and policy and budgets. Healthcare is regulated by the Health and Medical Service Act. Healthcare providers are obliged to register their activities with the Health and Social Care Inspectorate. While complementary and alternative medicine methods like acupuncture and mindfulness are supported in certain cases, Ayurveda is not included in the healthcare system funded by taxes. We are now approximately 300 practitioners of Ayurveda, and over 10,000 individuals possesses basic knowledge about Ayurveda from one of the 3 different schools offering Ayurvedic training. Ayurveda has been known for around 40 years, and the first school started the programs by then. This certification program range from basic 250 hours courses to more advanced training in Panchakarma, Shirodhara, Ayurvedic massage. People who seek Ayurvedic treatment or consultate often come to a practitioner once or twice, or for treatment a few times. While there are more than 10 books on Ayurveda by Swedish authors, many in the general population have never heard about Ayurveda. 2 podcasts do talks about Ayurveda, which has gained a huge popularity within the last years. There has been a need to unite the practitioners and create a platform for Ayurveda in Sweden. Therefore, we have set up Ayurveda Sweden Association, the first Ayurvedic association in our country. ASA aimed to provide a platform for the practice, for education and research for Ayurveda. We have encountered challenges in gaining recognition and education in our society by Ayurveda's benefits. The way forward involves inspiring people to incorporate Ayurveda in their daily lives and bridging the gap between modern science and traditional Ayurvedic practice. Sweden, driven by its demand for research and statistics, is ready to embrace the new healthcare paradigm. People of Sweden have for centuries given away the practice of healthcare to an outside authority, telling whether we're sick or not. We have now come to that point where we need to reconnect the body, mind and soul, as well as deep ancient healing knowledge with science. Since 80% of all our diseases relates to unhealthy lifestyle, Ayurveda offers simple lifestyle changes that has huge impact on our population's health. Ayurveda also recognizes not only what modern science now also have found out, that most of our diseases can be related to our gut health and to our mind, our thoughts and our beliefs. It is time for us to reconnect the concept we once lost, the body, mind and soul. We are one. For me, Ayurveda serves as a bridge between humans and nature, a language that we slowly but surely are beginning to learn. Sometimes we search far and wide for something, only to realize that it is within us and has been here all the time, within our hearts, in nature and in every breath. This is when true healing happens from the inside, and Ayurveda aids in restoring the balance for human and nature. To conclude, I would like to share a quote from Dag Hammarskjöld, the former General Secretary of the United Nations. Do not look back and do not dream about the future. It will never gather back the past nor satisfy your other daydreams. Your duty, your reward, your destiny is in the present moment. Thank you.
Thank you, Stina. Thank you very much. We are proud that you are sparing time to be with us. I would like to invite Stina for her few comments on Ayurveda live. Please unmute.
Yes, hello.
Ah.
I'm in Sweden,
Hello.
and I am at the exhibition on health today. So I'm happy to be here. And well, as I said, it's in Sweden. It's about this non-communicable disease are quite an issue this year, and we also discuss a lot about the mental health. And I think that Ayurveda helps a lot, since we are dealing with lifestyle disorders, and we, as I said before, the connection to nature is fundamental for the whole being. So Ayurveda is gaining popularity here, and more and more people are aware of it. And today I'm happy to, at this exhibition, we have a famous Swedish author who also have been to Panchakarma in India. So she really promotes Ayurveda, and that's what we see here. Many people who gain, they really have benefits from the tradition from India. So we're so happy about it. We need to adjust because we are living on in a country where the sun is not up that much during winter time, and the opposite in summertime when we have 24 hours of sun. So that's what we have to adjust accordingly to the seasons here. I'm so happy that you invited me, and thank you so much for arranging this fantastic day today. I've been with you the whole afternoon, even though I've been in an exhibition. It's fantastic. So thanks a lot, and thank you so much for inviting.
Thank
It
you.
was good,
Thank you,
Stina,
Stina. Thank
speaking to
you.
you. We have Dr. Remita still here.
Yes, ma'am.
Yes.
Okay.
Am I
Okay.
audible now?
Yes, fine.
Okay. Sorry for the trouble earlier. It was some issue with my laptop. First of all, I would like to thank the Embassy of India, Sweden, and Latvia, University of Latvia, and Independent Research Ethics Society, Kolkata, for giving me this opportunity, and especially Shantala ma'am. Thank you so much for having given this opportunity. Long COVID is it's actually a serious problem these days, with many people having suffered from COVID during its active phase, and now we are still suffering with the side effects of those. And I have personally worked with Shantala ma'am on a case of herpes ophthalmicus, which was a secondary infection of COVID, as well as if we consider the mucormycosis cases that were prevalent, or the black fungus cases which were prevalent after the COVID. It was very evident that it was the misuse or excessive use of antibiotics or antivirals during the active phase which led to that condition. So I feel that we should learn from all these experiences. COVID has taught us a lot, and moving forward, like as we have International Day of Yoga, I hope that one day we will have International Day of Ayurveda too. Right now we are celebrating National Day of Ayurveda. I hope maybe next year, or another 2 years or 5 years, probably we will have International Day of Ayurveda too. With that, I once again uh, thank you everyone for giving me this opportunity.
Thank
So
you. Thank you, Dr. Ramita. Thank you very much.
Actually,
Now
you
I would
didn't
like
hear
to.
Dr. Nesri sir say that it is almost like Global Ayurveda Day today, and Professor Sharma was also saying it has become global now.
yes, ma'am. Yes, ma'am. We are celebrating it, but as we adopt yoga, we need to reach out there in terms of, because being in a yoga university, I know what the reach of yoga has been. Since our Chancellor, Dr. H.R. Nagendraji, sir had
Right,
proposed the
right,
celebration
right,
of Yoga Day. So likewise, I suppose, I expect that we can celebrate, over a global audience, that too.
right. Very good.
Thank you.
Who is the next speaker now?
Hemamalini.
Hema Malini. Sir, you are able to hear?
No.
From Essen, Germany. Dr. Hema
Sir, now
Malini
you are able to hear?
from Essen, Germany, the founder.
Why is it not coming? I have switched
Voice,
on both.
voice, ma'am, voice is coming, but video is not on.
Dr. Hema Malini from Essen, Germany, the founder of Swaraksha Ayurveda Holistic Healthcare. Feeling very much glad
Now we
to
are able
share
to hear,
with
sir?
you
Hear and
today's
see?
topic, why Ayurveda is so prevalent.
Voice is here.
And feeling so much grateful to advent on this journey of propagation of our holistic science.
No problem. Please play next video. Now time is 11.
Oh.
Yeah, please play next video. Hema has already spoken. Dr. Hema, I will invite you after this video directly.
No wonder post-COVID, globally we have hit the light. So now it becomes our prime duty to propagate the traditional wisdom of.
Sir, you are able to hear?
No, madam, black screen. I would like to invite Dr. Hema Malini directly for few minutes. Dr. Hema, please. Dr. Hema ji.
Yes, sir.
Can you play the video? Can you share your video?
Not clear. So here it is raining and the network is not proper here.
No problem. Ex tempo, you can continue. Please.
Yeah. So I had actually done a PPT on why Ayurveda is so prevalent today.
No.
Shri Gurubhyo Namaha.
Yes. Hema ji, please.
Yeah, I had done a PPT on why Ayurveda is so prevalent today, and I had shared some of the views on how Ayurveda is prevalent in globally.
Before going
and
to
the main
today,
takeaway was
globalization of Ayurveda. Let us go for some basics.
Thank you.
Madam, at present, Hema Malini is speaking. Please don't share anything.
That's why I put it off, sir.
Don't share. She directly speaking.
Yeah, actually, it would be better. I feel so. As ma'am shares, it would be better. I feel so because the takeaway was actually regarding the observation of the knowledge.
Dr. Hemaji, technical glitches are there. She is unable to play the video. So please conclude yourself in 7 minutes.
Okay, fine. So it is all about how we can upgrade ourselves and integrate ourselves in the propagation of Ayurveda. So it is without the PPTs, I'm
only 2 minutes
just
best
a minute.
wishes. Only 2 minutes best wishes. Now time is 2 hours.
Okay,
so we can't wait for that.
Okay, thank you, sir.
She is trying again and again, madam. But some technical glitch is there, and that is beyond the control level.
Sir, now you are able to see?
Agnihotri, sir, please.
Oh, no, ma'am, it's not there. Actually, Dr. Hema, you are asked to give some bad wishes.
Myself, Dr. Pooja is final year PG scholar from the department.
This is Pooja Sabharwal. This is next one. So, Dr. Hema, you can conclude yourself with saying a few well wishes
Before going to the
with this
main
platform.
concept of today, the globalization of Ayurveda.
Dr. Hema, if you are listening me.
What is Ayurveda? Is Ayurveda just herbal medicine or just Panchakarma procedure?
or medicine with no side effects. These are the keywords that we get when
Ma'am, this is Sabharwal's address. The next speaker, I think.
No problem, madam. No problem, sir. After this, we will call him.
Yes.
Time is over, madam. Sir,
Ayurveda
time
is
is over.
mainly made up of two words, Ayu and Veda, which indicates this is the science of life. Each and every individual should know how to live a healthy lifestyle, and this knowledge is present in Ayurveda. Healthful living, prevention of disease, personal and social hygiene, moral code and conduct, ethics in medicine, all these come under its ambit, and it is not just the cure of the disease. When it comes to the core concept of globalization, we should first address what Ayurveda has to offer to this world. Swasthasya swasthya rakshanam, aturasya vikara prashamanam. That is, maintaining the health of a healthy individual and treating the diseased. These are the two mottos that Ayurveda basically started off with. Ayurveda has a lot to offer in the Swasthasya swasthya rakshana, like immunology, rejuvenation therapy, dinacharya rutucharya, that is daily and seasonal regimen, moral code and conduct of life. And one can improve the quality of life by using Ayurveda, which is preventive, promotive, and also personalized in its approach. And basic concepts like food, sleep, and maintaining the celibacy, the geriatric care, all these and many such aspects has been explained in Ayurveda. When it comes to the healing the individual by its holistic approach is one uniqueness that Ayurveda has. Understanding a disease and treating it by the concept of Trisutra is one special aspect that Ayurveda has. Hetu, Linga and Aushadha, that is cause, clinical features and treatment. Treatment including medicine, Panchakarma procedure, Pathya, Apatya and many such aspects. This main concept helps us understand and treat the disease which is already present, and also it helps to analyze the probable pathology of newly emerging disorders. In the society where drug and disease model is flourishing, Ayurveda never believed in this concept, whereas it always had this individualistic and holistic approach towards the deceased person. When it comes to the ratio of prevention and cure, nowadays prevention is gaining a lot of importance. And Ayurveda has a lot of therapies like Rasayana therapies, which mainly propagates the idea of free from free radicals. That is, for example, if you take Bhargava Prokta Rasayana or Chyavanprash, which is tremendously rich in antioxidants, fights against the free radicals, which are mainly the causative factors for the pathology of many disorders. And the core concepts like the concept of Agni and the concept of altered metabolism being the cause for all the disorders, one has to be educated with Ayurveda so that one knows what to do and what not to do. And modification of lifestyle and diet can reverse the pathology and helps in the sustenance of life. This can be taught by learning Ayurveda. Whenever Ayurveda has something to offer to this world, everyone, including a layman, will ask about the scientific background. That is not wrong. That is important also. So we have to develop our own methodologies because Ayurveda has a unique approach, that is personalized and individualistic approach in treatment aspect. So we have to do some modifications in the methodology of research, and then we have to implement it in our researches so that it is accepted by everyone. And today, the qualitative research must be carried out in a huger scale rather than quantitative research. And by these rigorous evidence-based approaches, both diagnostic and therapeutically, we can go and present our science to the world. Today's Ayurveda students are the future generation, that is scholars, research enthusiasts and clinicians. So the main challenge that students are facing is cognitive dissonance. And we have to overcome this by inculcating the practical based approach for students and more of skillful learning, which NCISM nowadays is trying to inculcate in its curriculum also. Training and evaluation of Ayurveda academicians and clinicians, it should be done. The clinical practice of pure Ayurveda will take Ayurveda to global level. We have to regulate the quackery in the field by implementing strict rules, and we have to strengthen the Ayurveda education and research so that it definitely improves the status of Ayurveda globally. When it comes to the international market of Ayurveda, in 2020 we have reached $18.1 billion, which was just $2.85 billion in 2014-15, and now you can see how much it has grown. By the recent studies, there is an estimate that by the end of 2029, it can reach to $28.21 billion. So when we look at the broader aspect of globalization, Ministry of Ayush has thrived and supported Ayurveda a lot because of its international cooperation scheme for the promotion of Ayush globally, with the collaborations with more than 50 countries around the world. It has helped Ayurveda reach its global level. 24 country-to-country MOUs have been signed. 15 MOUs for academic chairs in Ayush in foreign universities has been done. 39 Ayush information cells are there in other countries. Recently, our Prime Minister, respected Narendra Modi ji, has announced that Ayush visa will be available for the foreign nationals who are interested in getting the benefits of Ayurveda treatment. And this has boosted the globalization aspect of Ayurveda a lot. And what the future holds in Ayurveda, if anybody asks the question, will 22nd century AD be the revolution era of Ayurveda? The answer will be a definite yes. Because we are already in the path of revolution. Many scientific researches have been carried out, and it's also going on, so that one fine day Ayurveda will be one of the mainstream medicines that are practiced in the world, and because it supports majorly in the prevention aspect and the promotion aspect, that is increasing the quality of life, and also in the primary healthcare system, which is the biggest necessity today. I would like to conclude my talk by saying that Vasudhaiva Kutumbakam, the whole world is our family, and we, the flag bearers of Ayurveda, are definitely ready to spread the good of Ayurveda to the world. Namaste. Thank you.
Thank you. Thank you very much. Thank you very much, Doctor. I would like to invite now Dr. Hema Malini for a few words. Dr. Hema, I am going to upload all videos, 2 videos per day for next 10 days as Ayurveda Day celebration. So don't be upset. Your video will be uploaded individually also. So now I would like to request Dr. Hema Malini ji for a few words.
Yes, thank you so much for the invite, sir. And I'm thanking heartfully each and every soul, Dr. Shantala Priyadarshini ma'am, Dr. Pavan Sharma ji, Dr. Agnihotri ji, and each and every one who had contributed not only for today's session, for the entire propagation of Ayurveda. And let this glory march with this glory. Let us march forward day by day and reach each and every people's, every citizen's heart, and let us take a pledge of leading an Ayurvedic way of life with Ayurvedic diet and Ayurvedic daily regimens. And regarding the Rutucharya, we can see our Ayurvedic regimens followed in most part of the countries with their own religion, in their own way of style, but it all reflects the Rutucharya. This means that our Ayurvedic science is completely universal and it is accepted by all. And let us all march forward, integrate ourselves, and moreover upgrade ourselves with more and more knowledge, with more research is going on, because our Ayurvedic science is not an outwardly science. It has so much of so much of glitters in it. So we shall try to bring out all the hidden beliefs to the outer world, because even now when we are all practicing Ayurvedic way of life, even now certain concepts are under researches like ojas, para ojas, upper ojas, and many more facts. So let us all strive together and bring all these hidden facts to the outer world, and let us lead a wonderful life. Loka samasta sukhino bhavantu. Thank you so much, sir, and thank you so much, ma'am.
Thank you, Dr. Emma. You are the best commander of AYUSH Samriddhi International Webinar Series. We are proud of you and thank you very much. We will be uploading your video, definitely. Thank you.
Shall we stop? Shall we stop the session now? And the remaining 4-5 people, maybe in 1 week, sometime you can give that time for everybody.
How can it be possible, madam?
So we'll finish off today. Everybody will be having 5 minutes each again. It will be 20 more minutes, sir. Is it okay for you?
Yes. But we will complete it today fast.
Okay. Sir, you got the presentation?
No presentation, but screen.
Namaste everyone. Myself, Dr. Venkatesh Gaonkar.
You are able to
from
hear,
Sirsi,
sir?
Karnataka. So greetings from our side. On behalf of Ayurveda Day. So we celebrate this Ayurveda Day by spreading the message of this holistic
we are
science.
hearing, but the screen is, video is not on.
Which is not. It is for maintaining the healthy life also. So the motto is Ayurveda is for one and video, all.
So
Okay.
So my friends,
only audio is there.
his voice
Only audio recording is there. Okay.
Ayurvedic science
play.
or the Shastra, which is held by the
moving videos,
God himself,
no
or
photos,
continued by the holy sages. So Swastasya Swastarakshanam means to maintain the healthy life of a healthy person. So one who is healthy, so he should maintain free from all the diseases and with his mental happiness also. So this is possible through the Ayurvedic way. And Aturasya Vikara Prashamanam means the curing of the diseases of one patient or one diseased person. So both the Aturasya Vikara Prashamanam and the Swastasya Swastirakshanam, which tells Ayurveda is one, Ayurveda is for one and all. So we'll take one example here. So I'll simplify by one example. So two persons are there here. So one person is around, so two persons are there of 30 ages. So one person is not watching 60 kgs and one person weighs around 100 kg. So 60 kg person is trying to maintain
she is telling that he has sent only video, only audio cassette recording, not video.
So no, he has by sent, following the Ayurvedic principles,
there are no photos in that.
Ayurvedic, all the sayings said by our sages or the Shastra, the both can be benefited. So how? See, this 60 kg person will maintain his health by having the proper diet and having the Vyayamas. Vyayamas means exercises correctly in the time to time. And one shloka is saying, Guru cha apatarpanam deyam. So means he has to follow the diet which contains Guru Ahara, which contains the vegetables, fruits and all raw fruits, raw foods, etc. to maintain his weight and not to get so much of calories. So this 60 kg person, by eating this diet and doing proper exercises as said by the Vyayama. So Vyayama Vidhi. he will maintain his weight and he is free of all the diseases. So this 100 kg person, also follows the same formula and follows the Guru's Tapatarpanam Deyam, this diet plan, and he also benefited. He is continuously losing his weight. After 1 year, 1.5 years, he will be fit. So Ayurveda, which is benefiting both the persons, which is one is healthy and one is obese. So like that. Another one example we can take by osteoarthritis of knees. So one patient is in the first stage of osteoarthritis and one patient is in the third stage or fourth stage of osteoarthritis. We call it as Sandhivata. So this Sandhivata patient, first stage patient, will maintain exercises and proper diet, and he maintains or by this diet plan. And another person who is already having osteoarthritis, he takes some Ayurveda medications and some Ayurveda treatments, and he will be getting cure of it. So both the persons will be benefited. So this message why I am giving means, so Ayurveda is for one and all. So all should follow this diet and regimen, the Rutucharya, Dinacharya, which is said by the Acharyas, and we have to maintain our health also and get cured by the diseases also. So I request everyone to follow all this, the rules followed by the Acharyas or rules set by the Acharyas, to lead our life very healthily. Thank you one and all.
Thank you, doctor. Thank you very much. It was the last lecture of the day. With the kind permission of Agnihotri sir, we would like to conduct this next session because time is too late, 2 hours beyond our expectations. So we would like to conduct this last session tomorrow 2 p.m. if you kindly permit.
Sir, I think that is the best one. I will inform the remaining people, and tomorrow 2 o'clock.
Indian IST 2 p.m. I don't know whether, madam, what will be time within.
Okay, sir. I will check it out. Only I'm from Latvia. All the others are India only.
Okay.
So
it may be early hours for your side.
No problem. What time will be Indian time? 12 o'clock.
2 p.m.
Okay.
Indian IST 2 p.m.
Okay, sir. Okay. Thank you very much for such a beautiful program. So we will finalize it tomorrow. And thank you very much. If in case the speakers want to be there tomorrow, we will see if they can come. Okay, sir. Thank you very much.
Thank you, Agnihotri sir. Agnihotri sir.
Thank you,
final
sir.
conclusion.
Conclusion, sir.
Thank you, sir. Thank you, Professor Pamshamaji. We were just concluding our this fourth scientific session, which was based on the topic unique Ayurvedic for one health, and we got a number of good speakers. Dr. Lamita was there, and Dr. Miss Christina Anderson, and the third one is Dr. Hema Malini, and the fourth one the Pooja Sabharwal. All these persons paid full attention regarding the promotion of the Ayurveda at their end in their countries. Dr. Ramita very confidently promoted and talked about the post-COVID scenario, and she advocated all the procedures done by the Ayurvedic system of medicine there in Bangalore, and she is interested enough that the Yoga University is doing a lot. So she is a well-wisher of becoming this Rashtriya Ayurveda Day as an International Ayurveda Day. The day will definitely come. And Dr. Miss Christina Anderson talked about a lot, and she is much more acquainted with us, our platform IRES. She has spoken so many times, and by profession, she told that she's an engineer.
Yes, sir.
Still then, she learned Ayurveda there in Cambridge, in UK, and also now became a good ambassador of Ayurveda in their country, in Sweden. So she was very familiar to us, and she is doing a lot informing that they are developing the alternative medicine like acupressure there and promoting Ayurveda as such. So, and she's also having some Ayurvedic association there. So, and she was physically present also. So she also said, addressed a few sentences in the same manner. Dr. Hemaldi definitely had some glitches over the presentation, but she ultimately joined and directly extended her views over the well-being of Ayurveda in the coming years. She is also talking about the Vasudhaiva Kutumbakam concept. For that, she told that Ayurvedic regime should be followed properly, and we will be having good health. So was the case with the Pooja Sabharwal. She also advocated regarding the personal hygiene, social hygiene, moral conduct, code of conduct, and also preventive and curative diet, abstinence, and sleep as such. All the basics principles of Ayurveda for the healthy life and to maintain the life as such, so that the lifestyle disorders will not take place. With these words, I think I cover all the guest speakers' presentation of fourth this session. At the same time, all the speakers, guest speakers who really ornamented our platform, your platform, Latvia's platform, and all the embassy of all the related countries, right from 6 p.m. of IST to 11:15, 14 IST. I'm really thankful to all the efforts made by international dignitaries to make this Ayurveda Day a great success and conveyed the whole of the basic themes of Ayurveda, that whenever we are here, whenever we are anywhere, we are supposed to lead a healthy, quality life and follow the instructions for a better quality life. But sorry that we are still working up after 11:30 and not following the basics of taking proper type dinner and taking a proper quality and quantity of sleep. But still we are doing for the greater cause of promotion of Ayurveda. So Jai Ayurveda, जय राष्ट्रीय आयुर्वेद दिवस एंड लॉर्ड भगवंती जी की को बहुत बहुत उनके जन्म दिवस के लिए हम सब लोग प्रसन्न हैं और उनके आशीर्वाद की आकांक्षी हैं। नमस्कार, थैंक यू।
वो आज उनका जन्म दिवस नहीं है सर, अवतरण दिवस,
आविर्भाव।
अब नहीं, अवतरण दिवस है क्योंकि वो तो 6 फुट के पैदा हुए थे।
हाँ, तो आविर्भाव हम तो मानते हैं, उनका तो आविर्भाव हुआ है।
आविर्भाव हुआ है, बिल्कुल
ठीक है सर। नमस्ते सर, गुड नाइट।
थैंक यू। कल 2 बजे मिलते हैं। शांतला जी, सैल्यूट टू यू। शांतला जी, सैल्यूट टू यू।
With all disturbances, she maintained at least 99% maintained.
मैडम ने आज फर्स्ट टाइम पूरा का पूरा वीडियो किया और ग्रेट किया। अरे टेक्निकल ग्लिच तो अच्छे अच्छे एक्सपर्ट के सामने आती है। डोंट गेट नर्वस मैडम, एक्सीलेंट,
बहुत अच्छा किया, बहुत अच्छा लगा।
और अब हम लोग ये ऑल स्पीकर्स के 2 वीडियो रोज इसी आयुर्वेद डे सेलिब्रेशन के नाम से अगले 12 दिन तक चलाने वाले हैं। पिछले 2 दिनों से हम कर रहे हैं और अगले 12 दिनों तक चलेगा। तो आप ये समझ लो पूरा सेंसेशन बना रहेगा। सब ऑल पर्सन्स की मैं ईमेल आईडी भी वीडियो में दूंगा, जिससे वो वीडियो लोग वक्त देखें और उनसे कांटेक्ट करें।
नहीं मतलब तब तक भगवान धन्वंतरी जी का क्या 100 का काल चलेगा, प्रसूता काल चलेगा और जाड़े आ गए तो हरीरा वरा भी मिलना चाहिए। हरीरा पंजीरी मिलेगी तभी सच्चा रसायन सेवन हो जाएगा ना। गुड नाइट।
बहुत अच्छा राजी, गुड नाइट मैडम।